Hello and welcome to my YouTube channel. My name is Eliam Bridget Osareti and I'm a 500 level nursing student that loves Jesus. On this Christian channel, we post nursing tutorials, and as at now, we are on our med search series where we would be taking the pathophysiology of every disease conditions in all systems of med search. We also post DIY hair videos occasionally, so you can check that on our shorts. So, if you're new to this channel, you are very welcome and please stay tuned. By the way, this is our first video, so I'm guessing everyone is new. Anyways, don't forget to like, share and subscribe if you gained any knowledge from this video. I mean any at all. And please also leave your comments or your questions in the comment sections, and I promise to respond to every single one of them. Today we are going to be learning the pathophysiology of inflammation in 7 minutes or 7 minutes and some seconds. So without further ado, let's hit the start button. Now we're going to start with the definition of inflammation. What is inflammation? Inflammation is a body's response to irritants of any kind, and these irritants may be due to burns, traumas, heat, microorganism invasion. Any form of injury would cause an inflammation. Now that we know the definition of inflammation, now what are the causes of inflammation? What are the predisposing factors or the major things that can lead to inflammation? The causes of inflammation may be divided into the predisposing factors, and then they may also be divided based on their duration. For the predisposing factors, there are various things that can predispose a person to inflammation. And these predisposing factors may be physical, chemical, or infectious. Examples of physical predisposing factors are things that happen to us every day, regularly, like injury. Maybe you fall and then you injure. Those are physical predisposing factors. Or maybe let's say heat, burn, or when you open pot, the steam from the boiling pot or something can lead to physical injuries, which can lead to inflammation. Then moving on to chemical predisposing factors. Some chemical factors that may cause inflammation are acid burns. Any form of chemical burns, see acid burn, burns from base, etc. Then as for the infectious predisposing factors, any form of microorganism infection, for example bacteria, viral, fungi, any form of infection. Once you see a bacterial infection, you notice that person usually go through inflammation. For example, pimples now. You see that the face becomes inflamed and then there's swelling and all that. That's an example of an infectious predisposing factor of inflammation. Then, based on the duration, we have the acute and the chronic. With the name, you will know already that acute has to do with what? Short-term symptoms. So, acute inflammation, they tend to last only for a short while. As for why chronic inflammation tend to last for a long while. Example of an acute inflammation, we have things like bronchitis, tonsillitis, and the rest. While examples of chronic, we have things like arthritis, you get that don't heal on time. Those are examples of chronic, that's long-term inflammation. Lastly, we have inflammation that may be due to autoimmune reaction, for example in Crohn's disease. Now moving on to the stages of inflammation, we have three major stages of inflammation, and these include the hematoma stage, the phagocytosis stage, and the healing stage. The hematoma stage is characterized by bleeding, vasoconstriction, etc. That's this hematoma stage is usually at the beginning, the moment you have an injury. Let's say you have a burn now, a burn. At that moment, what's the first thing that you see? You see, maybe, okay, if it's an injury, you see bleeding. Are you getting? But if it's a burn, you see that place becoming red, it's becoming vasoconstricted. That is, more blood moves towards that place. So that's what hematoma stage is mainly about. As for the phagocytosis stage is mostly about white blood cells moving to that area. You get, that is white blood cells, also known as the leukocytes. They move to that area, and mostly they usually move with blood. They move to that area to engulf foreign bodies there in order to prevent an infection. So they go there and engulf it, and is that phagocytosis stage that will lead to pus formation, because once the white blood cells engulf bacteria, pus will be formed. So that will now lead us to the healing stage. Usually this healing stage to occur in major injuries too, the pus must be drained properly. If it's not drained properly, that pus may lead to further infection. So a major factor that affects healing stage is pus drainage. So for the healing stage, it's mostly about healing, as name goes. It's just about healing of that affected area. Now we're going to be moving on to the general pathophysiology of inflammation, but we're going to be taking it step by step. So first of all, we'll start with the hematoma stage. In the hematoma stage, the first thing that must occur in every pathophysiology in med-surg is that there must be a causative agent. Causative agent is, as name goes, whatever caused that disease or inflammation in this situation. So the causative agents may be injury, trauma, heat, that is hot water burn, anything may be the causative agent. So this causative agent will cause the body to release hormones like histamine and prostaglandin. Histamine and prostaglandin will cause vasoconstriction and dilation. And like I mentioned before, vasoconstriction and dilation will lead to what? Blood, blood vessels dilating and increasing blood flow to that particular area. And once there is increased blood flow in that area, blood usually comes with what? What is blood? Blood is a fluid substance, abi? It contains water. It contains, I told you before that it contains leukocytes, white blood cells, and the rest. It contains um it also contains pigments. It contains heat. So as it's coming with a lot of package. And since there is increased blood flow, there will be what? Accumulation of blood and fluid around that inflamed area. Are you get around the area where there is injury or burn or anything? There will be accumulated blood and fluid, and this is also known as what? Exudate formation. So once there is exudate formation, once it will lead to what? Swelling. Exudate means that there's fluid and blood there, so that place will usually swell up. So once there's swelling causes pain because there are pain receptors around that area. So swelling will cause irritation of those nerves, those receptors around that area. And there will also be redness around that area. Why? Because blood comes with pigments. Blood is pigmented. The area will also be hot because blood travels with what? With heat. So that's for that. And after which all these things now that I'm mentioning to you, they are the causes of the signs and symptoms. All these things now will lead to the person not being able to use that area. So it will lead to what? Loss of function around that area. So that's that for hematoma stage. Next, we are going to be talking about the phagocytosis and the healing stage. Now, for the phagocytosis stage, the first thing that happens, I told you before that blood travels with white blood cells and leukocytes and the rest. So the leukocytes, in that once it gets to the area of injury or whatever, or bone or whatever, the leukocytes will absorb the bacteria that are around that place, and then they will ingest these bacteria that they have absorbed. Once they ingest it, they will expand due to the ingestion of it large amounts of bacteria. And due to this ingestion of the large amounts of bacteria, these leukocytes will undergo lysis. That is, they will die. That is, they will break down. And once there is lysis, there will be release of cytokinesis. And cytokinesis are what? They are chemical signals which cause local inflammatory reactions, including swelling, redness, and fever. And this cytokinesis also attracts new leukocytes to fight bacteria. So that's that for the phagocytosis stage. After the phagocytosis stage, then there will be healing. The healing stage is greatly hastened by treatments, but a major factor that affects this healing stage is drainage of the pus or exudate that comes from the phagocytosis stage, especially during big injuries, like major injuries. You need to drain the pus, or else if you don't drain it on time, that pus may lead to further infection again. Now moving on to the signs and symptoms of inflammation. As you can see here, the signs and symptoms are usually found in the pathophysiology. So they are part of the things that may have had occurred due to the hematoma stage or the phagocytosis stage. So the first sign and symptom you will find is fever and malaise. Fever may be due to the microorganism entering into systemic circulation. Headaches may also occur if the microorganisms enter systemic circulation. Nausea and vomiting may also occur. Swelling and tenderness or pain. This is usually due to the what they call it, the fluid that have moved to that affected area, and then the compression or irritation of the nerve endings around that area. Then you have loss of function of affected area, and this is usually due to what? Due to the pain or all other symptoms like I mentioned before. Then loss of appetite may also occur if the microorganism enters into systemic circulation. So that's for the signs and symptoms. Moving on, some nursing management of inflammation may include admitting the patient or treating the patient on an outpatient basis that is based on the severity of the inflammatory reaction. Then you may ensure adequate rest, apply hot and cold compress, encouraging adequate nutrition, especially nutritions that are rich in vitamin K, that's to aid proper healing. Then you should also give prescribed drugs and then give health talks on how to reduce the pain or manage the pains and other symptoms. Now that's all you need to know about the pathophysiology of inflammation. Thanks for watching. See you in my next video. Bye.